That nagging ache in your back, or the strange new urgency to visit the restroom, is it just a part of getting older, or could it be something more? Kidney stones are a common health concern among older adults, often presenting with subtle warning signs that are easily overlooked. Early detection is crucial for prompt treatment and preventing complications. In this presentation, we'll explore the 6 earliest signs of kidney stones, empowering you to recognize symptoms and seek timely medical care. Number 1, persistent pain in the lower abdomen, back or side. The first and often most memorable symptom of a kidney stone is a distinct and persistent pain. Now, this isn't like a simple muscle strain that might feel sore to the touch. This discomfort originates deep within your body. It typically starts in the mid-back or flank area, which is that fleshy part of your side between your ribs and your hip. This sensation is known as renal colic, and it's caused by the stone moving or creating a blockage inside the narrow tubes of your urinary tract. This pain is frequently described as intense and sharp, but it can also feel like a severe, deep ache. A key characteristic is its fluctuating nature. It often comes in waves, building in intensity over 20 to 60 minutes before it subsides, only to return again. This cyclical pattern happens because the urinary tract is contracting as it tries to push the stone along. As the stone travels downward from the kidney, you might notice the location of the pain migrating, moving from your flank toward the lower abdomen and eventually into the groin area. For many older adults, finding a comfortable position during these episodes can feel downright impossible. Lying down, sitting, or standing may offer no relief at all, which is a big indicator that the pain is not muscular or skeletal. This relentless discomfort is a primary signal from your body that something is wrong within the urinary system, and it should never be ignored or just dismissed as a simple backache that will go away on its own. While pain is often the most dramatic symptom, the next sign is far more subtle and is frequently mistaken for another common ailment. Number 2, pain or burning sensation during urination. Another classic early sign of a kidney stone is a sharp, stinging, or burning feeling when you urinate. This symptom happens as the stone makes its journey out of the kidney and moves closer to the bladder and urethra. You see, the stone can cause significant irritation and inflammation along the delicate lining of your urinary tract. When urine passes over this inflamed tissue, it results in that painful, burning sensation that can be quite alarming. Now, this particular symptom is very commonly confused with a urinary tract infection, or UTI, because the sensations are nearly identical. Many older adults, especially women who might have had UTIs before, may initially assume that's the cause. However, when this burning is accompanied by pain in your flank or back, a kidney stone becomes a much more likely culprit. The pain might be most intense right as you begin to urinate or just as you finish. It's the stone's physical presence and movement that creates this problem. As it scrapes along the ureter, that's the tube connecting the kidney to the bladder. It leaves behind an irritated path. When the stone finally drops into the bladder, it can continue to cause discomfort every time the bladder contracts to release urine. So, paying close attention to this symptom, rather than just dismissing it, is essential for getting an early and accurate diagnosis. This discomfort during urination is a clear signal, but your body might also send alerts through the sheer number of times you feel the need to go. Number 3, frequent or urgent need to urinate. An increasing and persistent need to urinate is a key indicator that a kidney stone has moved into the lower part of your urinary tract. As the stone gets near or enters the bladder, it can irritate the bladder wall. This irritation tricks your brain into thinking the bladder is full, even when it isn't. This leads to a bothersome combination of urinary frequency and urgency that can really disrupt daily life, and especially your sleep. You might notice that you're making more trips to the restroom than usual throughout the day, even without increasing how much you drink. This feeling can be accompanied by a sudden, overwhelming urge to urinate that is difficult to control. For some, this urgency can be so strong that it leads to concerns about incontinence. The symptom can be particularly disruptive at night, a condition known as nocturia, where you're awakened multiple times from sleep with the need to go to the bathroom. Because an overactive bladder can be a common issue for older adults, this symptom is frequently just chalked up to aging or other conditions. However, when this newfound frequency or urgency appears alongside other signs like back pain or discomfort during urination, it should definitely raise a red flag. The stone acts like a foreign object in the bladder, constantly stimulating the nerves that signal the need to go, creating a cycle of urgency and frequent, often unsatisfying, trips to the bathroom. Beyond the frequency and urgency, a more alarming visual clue can appear in the toilet bowl, demanding your immediate attention. Number 4. Blood in the urine, hematuria. Seeing blood in your urine is a concerning sign that should always be taken seriously, especially in older adults. This symptom is a very common sign of kidney stones. As the hard, crystallized stone moves and scrapes against the delicate lining of the kidney or ureter, it can cause bleeding. This irritation and minor injury to the tissue results in red blood cells leaking into the urine. The blood can change the color of your urine, making it look pink, red, or even brown, like cola or tea. This is called gross hematuria because the blood is visible to the naked eye. And believe it or not, even a small amount of blood can produce a noticeable color change. However, sometimes the bleeding is so minimal that it can't be seen without a microscope. This is known as microscopic hematuria and can only be detected through a urine test performed by a doctor. Any instance of visible blood in your urine warrants an immediate call to your healthcare provider. While it can be a sign of a kidney stone, it could also indicate other serious conditions, so a proper diagnosis is absolutely essential. For many people, noticing blood is the definitive sign that convinces them to seek medical help, leading to the discovery of a kidney stone that may have been causing other, more subtle symptoms. The appearance of your urine can offer more clues than just its color, as the next sign will reveal. Number 5. Cloudy or foul-smelling urine. Healthy urine is typically clear and has a very mild, almost unnoticeable odor. So, when you notice that your urine has become consistently cloudy, murky, or has developed a strong foul smell, it can be a sign that a kidney stone is causing trouble. These changes often indicate the presence of pus or bacteria in the urine, which can signal an underlying infection or significant inflammation related to the stone. The cloudiness is caused by white blood cells that your body sends to fight off the infection or inflammation from the stone. It can also be due to the shedding of tissue lining from the irritated urinary tract. The unpleasant odor often develops when bacteria begin to multiply in urine that isn't flowing freely. A kidney stone can create a partial blockage, causing urine to become stagnant behind the stone, which creates a perfect breeding ground for bacteria. For older adults, a urinary tract infection can be particularly dangerous and can escalate quickly to a more severe kidney infection or even sepsis if not treated promptly. Therefore, changes in the clarity or smell of your urine should not be dismissed. While dehydration can also cause urine to become more concentrated and have a stronger smell, the combination of a foul odor and a cloudy appearance is a significant warning sign that points toward a potential infection linked to a kidney stone. While urinary symptoms are common, a kidney stone can also trigger a response in a completely different part of your body. Number 6, nausea and vomiting. Feeling nauseous or even vomiting can be a surprising but very important early sign of a kidney stone. This digestive distress happens because the kidneys and the gastrointestinal tract actually share common nerve pathways. The intense pain from a kidney stone can disrupt these shared nerves, triggering a reflex response in your digestive system that results in feelings of nausea and, in some cases, actual vomiting. This connection is centered around a nerve network called the celiac plexus, which sends signals to both the kidneys and the stomach. When the kidney sends out powerful pain signals because of the stone, the brain can get its wires crossed and interpret the distress as coming from the stomach. As a result, the body may react as if it has ingested something toxic, leading to the urge to vomit as a protective measure. In some older adults, these digestive symptoms can be even more prominent than the classic back or flank pain, or they may occur before the pain becomes severe. It's not uncommon for someone to experience a sudden bout of nausea and vomiting without a clear cause, only to develop the telltale pain of a kidney stone hours later. Because of this, the true source of the problem can sometimes be misdiagnosed as a stomach bug or food poisoning, which delays the recognition of the kidney stone. Complications of untreated kidney stones. If kidney stones aren't identified and managed in their early stages, they can lead to significant and serious complications, particularly for older adults. One of the most common issues is a urinary tract infection. When a stone blocks the flow of urine, it allows bacteria to grow and multiply, potentially leading to a severe kidney infection known as pyelonephritis. This can cause a high fever, chills, and even more pain. Over time, a persistent blockage can cause the kidney to swell, a condition called hydronephrosis. This swelling puts pressure on the delicate kidney tissues, and if it's left untreated for too long, it can lead to permanent kidney damage and a loss of kidney function. This is especially risky for seniors who may already have reduced renal capacity. Why are older adults at higher risk? Several factors contribute to an increased risk of developing kidney stones with age. Chronic dehydration is a leading cause. As we get older, our sense of thirst can diminish, leading many of us to not drink enough fluids to keep our urine diluted. Certain medications commonly prescribed to seniors, such as diuretics for blood pressure, can also increase the concentration of minerals in the urine. Furthermore, underlying medical conditions that are more common in older adults, like gout, diabetes, and chronic kidney disease, can alter the body's chemistry and promote the formation of stones. The presence of these other chronic illnesses also means that older adults are more vulnerable to severe complications when a kidney stone does develop. When to seek immediate medical help. While it's always wise to consult a doctor for any suspected kidney stone symptoms, certain signs indicate a medical emergency that requires urgent attention. Older adults should seek immediate help if they experience severe, unmanageable pain that cannot be controlled with over-the-counter medication. The presence of a high fever or chills alongside other symptoms is a major red flag for a serious infection that could spread to the bloodstream. If you're experiencing persistent vomiting and are unable to keep any fluids down, you are at risk for severe dehydration, which requires medical intervention. Lastly, any noticeable amount of blood in the urine should prompt an urgent evaluation to rule out serious causes and prevent complications. Recognizing the early signs of kidney stones can make a significant difference in the health and well-being of older adults. By paying close attention to persistent pain, changes in urination, the presence of blood in the urine, and other subtle symptoms, you can seek timely treatment, prevent serious complications, and ensure better health outcomes. If you found this presentation helpful, please share it with your friends or family to help raise awareness about these important symptoms. For more health insights designed for seniors, subscribe to our channel. And feel free to comment with your experiences or questions below. We would love to hear from you.